William Holloway was one of the resuscitation team who worked for 2 hours to try to save Aishwarya in April last year. He was also the doctor who was first alerted to her rapidly deteriorating condition, hours after she'd been left waiting for treatment despite repeated pleas from her parents. Dr Holloway told the inquest at the time there'd been an unprecedented increase in the number of patients presenting to the hospital, but there weren't enough doctors and particularly nurses to meet the demand. He said that had left staff completely exhausted, telling the inquest, "We definitely felt we were under the pump and there was no end in sight." Dr Holloway fought back tears as he said the death of Aishwarya had had a devastating impact. He also asked to make a statement to her parents as they sat in the public gallery. Dr Holloway spoke directly to Aishwarya's parents, describing the night their daughter died as terrible and saying he was heartbroken that he couldn't save her. He said he wanted to assure them that every single person who worked on trying to resuscitate Aishwarya that night would never forget her. Later, senior nurse Catherine Davies gave evidence, telling the inquest the nurse-to-patient ratios were insane. She said on the night of the 7-year-old's death, she'd calculated there were about 9 patients to every nurse. She said while staff numbers had since increased, many of the new people were just out of university and not much had changed in the ED's workload, and another death was likely. "We're still extremely busy," she said. "It's going to happen again. I just think there's a massive disconnect between management and staff on the floor." More ED staff are expected to testify when the inquest resumes. Joanna Manar, ABC News.